Vanakkam. Welcome to this course on classics in neuroscience. From this video onwards, we start our discussion on a new topic, which is neuropsychiatry, the breakthrough in psychopharmacology, or how pharmacological agents came to be used in treatment of psychological or psychiatric disorders. Shown here in this picture is the basal ganglia and the dopaminergic system, the system that is believed to be responsible for reward related behavior. So, in this video we will look at antipsychotic drugs. Specifically, we will look at chlorpromazine and the work of Henry Laborit and Pierre Deniker and Jean Delay. In previous set of videos, what we have seen is the topic of signaling molecules. Remember, in the earliest weeks we looked at signaling molecules and neurotransmitters. So, we have looked at signaling molecules that underlie normal brain function. Normal means healthy, typical brain function. But there has always been an interest in identification of molecules that can help in treatment of mental disorders or psychiatric disorders. Practically all the breakthroughs in this field of identification of molecules to treat psychiatric disorders came in the decade between 1948 and 1958. Most of the major breakthroughs happened during the 1950s. Almost all of the modern psychopharmaceuticals were discovered arguably in the decade between 1948 and 1958. Now, when we discuss neuropsychiatric or psychopharmacological agents, it is best to start the discussion with antihistamines. So, it was well known in the field of medicine that histamine is released in the body during hypersensitivity reactions. For example, anaphylactic shock or allergic reactions causing sneezing. This is something that almost every one of us have gone through. So, when you have a cold, you constantly sneeze, there is a need for you to blow your nose, you have cold, you have need to clean up your nose, there is a runny nose, all this. This is because of the release of histamine in the body, natural process. But it is a very annoying thing, it is a very annoying symptom. So, there was a search to identify molecules that would reduce the effect of these histamines. These came to be called as antihistamines, the drugs that would reduce the effect of histamines or essentially reduce the symptoms. This symptom is very annoying. If you want to reduce that symptom, you apply or you take antihistamines. In the 1940s, both in the United States and in France, independently, there was identification of antihistamines. Their role is to reduce the amount of histamines, thus reducing these annoying symptoms such as sneezing, for example. For example, one of the popular compounds that was identified in the 1950s that is still popular, that is still being used as an antihistamine, for example, is diphenhydramine, or what is sold in a commercial name, for example, Benadryl. Even now, once I say Benadryl, everyone is able to identify, oh yeah, you must have taken it at some point in your life, Benadryl. So, popular drug. From that time till now, it is used as a antihistamine. So, there was an interest to identify a larger number of molecules that had similar properties or antihistamine properties. So, Paul Charpentier from the pharmaceutical company Rhone-Poulenc in France identified this chemical promethazine frequently sold under the name Phenergen. It was identified as an antihistamine. So, one important side effect, one crucial side effect of this medicine was that it made the patients very drowsy and made them feel very, very sleepy. It made the patients drowsy and sleepy. So, there was in addition to antihistamine properties, it also has sedative properties. Another compound that practically caused a revolution in psychiatry is chlorpromazine, also sold under the commercial names Largactil or Thorazine. It was discovered and identified by a naval surgeon who was stationed in Malta. Henry Laborit was a naval surgeon who was stationed in Malta, and he was interested in promethazine that was identified by Charpentier for two reasons. First is as a sedative, because he was interested in calming patients before surgery. So, it put them into a sort of potentiated anesthesia or a sort of artificial hibernation. And also he was interested in the antihistamine actions, because sometimes what happens under general anesthesia is the patients go into a sort of surgical shock, which leads to wild fluctuations of blood pressure. Because Laborit found promethazine useful, he requested the pharmaceutical company Rhone-Poulenc for more compounds that had similar or better actions. So, around that time Charpentier had synthesized the compound 4560 Rp, also called as chlorpromazine, but it was not really used a lot. It was kept on the shelf because it was not really that effective as an antihistamine, but it was a very powerful sedative. So, when Laborit requested for more compounds that were as good or better than promethazine, for example, the company sent him chlorpromazine, and Laborit found that chlorpromazine had this effect of beautiful calming effect. He called this as quietude beatific or beautiful calmness. Such was the effect of this chlorpromazine on patients. So, he suggested this chemical, this compound, to his colleagues and friends who were looking for chemicals or drugs to calm agitated patients, but it was not found to be that effective. Although many people attempted this, it was not found to be very effective for most of the patients. The breakthrough in identifying this, identifying the proper way to use this, came between 1951 and 52, when Perry Deniker and Jean Delay used a new approach whereby they started the dosage in small doses. They kept on increasing the dose. In this approach, suddenly they found that there was a dramatic calming effect. There was a dramatic calming of agitated patients, the reduction of anxiety, an improvement in paranoia, and improvement in the symptoms of manic psychotic symptoms. This field was so exciting at that time that within a short time span of 6 months, there were 11 publications claiming the use and effectiveness of chlorpromazine in various types of psychiatric disorders. And calming effect of chlorpromazine in these cases is called as this beautiful calmness or quietude beatific. As with other drugs, chlorpromazine also had some side effects. The important side effect was that it induced Parkinsonian symptoms in people who took the drug. So, there was a need to properly dose the medicine so that one has to have the calming effect, but not get the Parkinsonian symptoms. For example, inability to make movements or freezing of gait or tremors or so many other Parkinsonian symptoms. This Parkinsonian effect helped to identify the mechanism by which this drug acted on the brain. Of course, because it had large actions, the name of this drug, commercial name of this drug came to be Largactil. And Labat in 1953 demonstrated the effectiveness of chlorpromazine in various psychiatric disorders such as depression, addiction, withdrawal and schizophrenia. And all of this are relatively broad spectrum. Yes. And by 1953 already there was a Largactil symposium to study the effects of Largactil or chlorpromazine in various psychiatric disorders. That was organized in November 1953 in Basel in Switzerland. In 1955 the drug was adopted in the United States under the commercial name Thorazine. As mentioned by Deniker himself, this was the first time that a single drug was active in the treatment of major psychosis. Many different types of psychosis, a single drug is effective in addressing all of them. With this, we come to the end of this video. In this video, we looked at antipsychotic drugs. Specifically, we looked at antihistamines, including promethazine. Then we looked in detail about the drug chlorpromazine or Largactil and Thorazine, and the contributions of Henry Laborit in discovering this or identifying this, and the dosing idea that came from Pierre Deniker and Jean Delaine. With this, we come to the end of this video. Thank you for your attention.